If you're going to be taking pharmacology in nursing school, here are 10 medication suffixes that you must know. The first suffixes we have are sone and olone. These belong to the corticosteroids. For example, like prednisone. So whenever you see that, think corticosteroids. Now, how do they work? They decrease inflammation. So whenever a patient's taking these, especially long term, they cannot just be abruptly stopped. They have to be tapered off that dose slowly. And you want to monitor for the following. First up is hyperglycemia. These medications increase that blood glucose level. Also, they can cause your patient to be at more risk for infection and unfortunate weight gain. Then we have Tide. This suffix belongs to the GLP-1 agonist, for instance like semaglutide. These medications are going to help control blood glucose levels and promote weight loss. Some big things you have to watch out with this class is that they can cause some GI upset, leading to nausea, vomiting, diarrhea, so you really want to monitor your patient's hydration status, and they could affect the pancreas, leading to pancreatitis. OLOL, whenever you see that suffix, think beta blockers, for instance, like propranolol. So how these medications work is that they want to decrease the heart rate and blood pressure, which is great if you have like hypertension going on or some other cardiac issue. However, with these medications, especially the non-selective beta blockers, you want to remember not to give them to patients who have asthma or COPD because they could cause bronchoconstriction and make those conditions way worse. With these, what you want to monitor for is bradycardia, heart rate less than 60, whatever the parameters are that the healthcare provider has given you, and monitor that blood pressure because they can drop it and cause hypotension. Then we have pril. This suffix is going to be associated with ACE inhibitors, for instance, like captopril. How they're going to work, their goal is to decrease the blood pressure. But some things you want to monitor for is that this class of medications can increase that potassium level, leading to hyperkalemia. They can also, in some patients, cause this dry, annoying, hacking cough. This is typically harmless, but some patients can't tolerate it, and if that's the case, they can usually be switched to another class of medication known as the ARBs. Then another condition that can happen, it's rare, but it's serious if it does, is known as angioedema. This is where you get swelling in the face and the airway. Then we have Xolair or Zepam. These suffixes belong to the benzodiazepines, for example, like diazepam. How these medications work is that they are going to provide a sedative effect, so they're sedatives. With these, because they are sedatives, you have to monitor the patient's sedation status, making sure that they're not receiving too much of them, along with respiratory depression, and that they're not developing dependence on them. So with that said, you want to definitely remember the antidote. So if your patient does get too much of this, you can give them that, which is flumazenil. Then we have the suffix statin. These are associated with the HMG-CoAce reductase inhibitors. And all that fancy term means is that these medications are going to lower your cholesterol. However, with these, there's a couple things that you want to monitor for. First up, you want to monitor that liver function. It can elevate those liver enzymes. Also, assess your patient for any muscle issues like pain because it can lead to a condition known as rhabdomyolysis. Next is semide. This suffix is associated with the loop diuretics, for instance, like furosemide. How these medications work is that they are going to remove excessive fluid from the body. However, because we're doing that, we can cause some problems. Therefore, you want to monitor, of course, for dehydration. So look at that patient's urinary output, look at their blood pressure. Is it too low? Well, we might be removing way too much fluid. Another thing with loop diuretics is that they can really drop that potassium level, so they can cause hypokalemia. A lot of patients are going to be on potassium supplements while taking this medication. Then we have Prazol. This suffix is going to belong to those proton pump inhibitors, for instance, like omeprazole. So how they're going to work is they're, just like their name says, they're going to inhibit that proton pump within those proton cells in the stomach. Whenever we do that, we are really going to decrease stomach acid production. However, since we are affecting that, you have to monitor the patient for some interesting complications that could arise, especially from long-term use. For instance, with long-term use, they could increase the risk of developing a C. diff infection, vitamin B12 deficiency, a low magnesium level, and it could affect their bones, leading to an increased risk of bone fractures. Up next is the suffix terol. These are your beta-2 agonists, for instance, like albuterol. And how they work is they are going to dilate those airways. A fancy way of saying that is they're going to cause bronchodilation. However, because we're affecting beta-2 receptors, there are some side effects you want to be familiar with. The patient can start to experience tachycardia, where that heart rate goes up. They can start to feel jittery, a little anxious, in addition to having tremors. And then lastly, we have sartan. These are your ARBs, which stands for angiotensin II receptor blockers. And this includes, for instance, like losartan. How they're going to work is they are going to drop the blood pressure by blocking angiotensin II. However, because we're affecting those functions, there's two huge things you want to monitor for. First up is hyperkalemia. It can raise the potassium level and it can lower that blood pressure, hypotension. Okay, so that wraps up this quick review. If you'd like to watch more videos like this, you can access the link in the description below.